Hello. Today I'm talking about emotionally focused therapy for couples of color by Dr. Paul T. Guillory. And one of the main points that he drives home is white therapists working with couples of color. Is a lot what the presentation was about. This was a very clinician focused course. He introduced it by sharing that this is a very understudied area. Most books that discuss working with couples of color might commit a chapter, sometimes two, to discussing couples of color. And most of it is about the experience of living as a person of color in the United States, with an average of 2 paragraphs on clinical implications. So most of us receive very little to no training about this. And this is doing a disservice to clients because the majority of people of color in the United States will, out of necessity, work with a white therapist. And the dynamic that we see a lot of the time, because there's not a lot of therapists of color. Washington, I looked it up, I think is the third highest state in terms of therapists of color, and we still don't have very many. It's really low numbers, and so really, really hard for people to find a therapist of color. And so the dynamic that happens a lot is that while that difference of experience is in the room, it doesn't get brought up because just like sex, if the therapist doesn't bring up the topic, it's probably not getting talked about. A lot of therapists avoid the topic, yes, out of their own discomfort. And I might switch between saying their, meaning therapists in general, and our, because I'm also a white therapist talking about this, uh, often out of their own discomfort around the topic. And the question that gets asked a lot and was asked in this course is, what if the issue isn't that I'm uncomfortable talking about it? What if the issue is that I don't want to be yet another white person that my client then feels like they have to educate because that's not their job, and I don't want to make them do that. And this keeps us from having important conversations. And even like bringing that up, like, hey, can I ask you things that I'm missing as a white person here? Um, you might get a response like, I don't want to educate another white person. Like, that can happen, but that conversation is still really clinically valuable because then you're able to like discuss the relationship between you and the client. So that is important. Um, it's also important to understand that most couples talk about race within their relationship. And this is couples of color, right? Or mixed race couples. 51% of couples talk about it daily or a few times a week. And there's often a level of comfort talking about race within the relationship that doesn't necessarily translate outside of the relationship. And this is, once again, why the therapist really needs to be the person to bring this up. That was a large part of his presentation. But Dr. Guillory also talked about epigenetic trauma and how often it is in the room. This everyday stress affects the couple, often in terms of internalized devaluation, feeling or belief that I'm not as good as, lack of compassion for the self or view of self, which is largely based on socialization. and has very little to do with the person themselves. And it can result in anxiety, avoidance, and ambivalence, which are all relational. Those are attachment styles, right? And so the goal of that emotionally focused therapy is to help balance the view of the self outside of the deficit model, because more compassion for the self then means more compassion for others, and it creates more resiliency in self-worth. So the biggest challenge there is us working through our own discomfort so that we can talk about what's happening in the room. And it's likely to be uncomfortable for the therapist in a conversation that we need to have anyhow. I hope that this is helpful, and I welcome questions. I'm sharing the slides on this as well, and I will be back with more.